Colle's fracture, also known as a distal radius fracture, is a common type of fracture that occurs in the forearm. It involves the breaking of the radius bone in the distal, lower, part of the forearm, near the wrist. Radiological and imaging analysis plays a crucial role in the diagnosis and management of Colle's fracture. Let's explore the detailed and descriptive process of radiological and imaging analysis for this type of fracture. 1. X-ray examination. X-ray imaging is typically the first-line investigation for evaluating Colle's fracture. 1. The examination involves the following standard views. A. Anteroposterior (AP) view. The patient's forearm is placed on the X-ray cassette with the palm down, and the X-ray beam is directed from the front, anterior, to the back, posterior, of the wrist. This view allows for the assessment of the alignment of the fracture, displacement, and the involvement of the joint surfaces. B. Lateral view. The patient's forearm is positioned on the X-ray cassette, with the side of the hand against the cassette, and the X-ray beam is directed from the side, lateral, of the wrist. This view provides a better visualization of the dorsal tilt, volar tilt, and radial shortening, which are important parameters for assessing the fracture. 1. Radiographic findings. During the analysis of the X-ray images, the radiologist looks for specific characteristics that aid in the diagnosis and classification of Colle's fracture. 1. These findings include: A. Fracture line. The presence of a fracture line through the distal radius indicates the presence of a Colle's fracture. The line may extend from the articular surface to the metaphysis or traverse through the entire bone. B. Angulation and displacement. The degree of angulation, dorsal tilt, backward displacement, and volar tilt, forward displacement, are evaluated. The direction and extent of displacement are important for determining the appropriate management strategy. C. Radial shortening. The amount of shortening of the radius bone is assessed. This measurement helps determine the severity of the fracture and guides treatment decisions. D. Intra-articular involvement. The involvement of the wrist joint is assessed to identify any articular surface involvement, as this can impact treatment options and prognosis. Computed tomography (CT) scan. In some cases, a CT scan may be performed to obtain more detailed information about the fracture. CT scans can provide three-dimensional reconstructions and precise measurements, particularly useful for complex fractures or when surgical intervention is being considered. CT imaging helps in assessing the fracture pattern, displacement, intra-articular involvement, and associated injuries. Magnetic resonance imaging (MRI), although not routinely performed for Colle's fractures, an MRI may be utilized in select cases. MRI is useful for evaluating soft tissue injuries, ligamentous involvement, associated tendon injuries, or assessing for any hidden occult fractures that may not be apparent on X-ray or CT imaging. Radiological and imaging analysis of Colle's fracture helps in accurate diagnosis, classification, and treatment planning. It provides essential information about the fracture pattern, displacement, involvement of joint surfaces, and associated injuries, which guide the orthopedic surgeon in determining the appropriate management strategy, whether conservative, non-surgical, or surgical intervention.